Namaste friends. Myself, I am Dr. Harshavardhan. I am a urologist and faculty at VISE Academy. This is a short video on helping you in clearing doubts and throwing some insight on how to select a hospital or medical college or a course like MCH or DNB in a particular place. So first I want to congratulate all you guys who have appeared for the exam and cleared the exam at various faculties like gastro, onco, uro, pediatric surgery, whatsoever. Congratulations on your cracking NEET SS. So this video intention is to help you in understanding what choices and what preferences you should look into before selecting a hospital or a DNB or MCH course. So before we go into the criteria, what should be the criteria to choose a hospital? I just want to make a small analogy from a Telugu movie where the protagonist, who is a hero, he goes in search of a bride. He says, "10 को देखो, 5 को shortlist करो, 2 को what you say, go and see them, and 1 को select करो and marry her." So like that, you are at crossroads now. You have different choices now. You have to choose between MCH ka payment seat, DNB, or going further for uh, reappearing the exam. So I hope this video will give you some insight on what you want and how to make a decision about your future. So, as I made an analogy with marriage, yes, choosing a hospital and being choosing a course and being with it for the next 3 years is definitely like a marriage. क्योंकि see, as a surgeon, will be having a practice up to the age of maybe 65, or someone who is really fit maybe up to the age of 70, 75. So as of now, most of you, let us assume the average age of NEET SS aspirant is around 30 years. So for the coming 30 to 35 years, you are married to the choice that you are going to make now. So the coming 3 years is going to be very crucial, and it is going to be a very what to say, life-changing decision for you. So be wise in making your choice now, because it is going to have a deep impact on how your future and your family's future and how your kids' future is going to be. By this time, most of you might be married. Your spouse also might be working, or she might be a doctor who is also getting a PG seat somewhere. You might be having kids who are just very small, maybe in kindergarten, or someone may be having newborns. So you have to have a balance between your career decision as well as your family life. So, having said that, see, it is very important. It is very important that you make a decision, um, which is definitely going to have a good outcome in your family life as well as your career. So now it is the time for you guys to pack your bags and explore stuff. In the sense, you may there might be a person who got rank 1 or below rank 10. They have their own they have clarity of choices, because for example, there is a candidate on urology ka rank 1 hai, rank 2, rank 3 hai, and they have already they might have made their decision to join a institute like IKDRC or SGPGI. Likewise, someone in SG surgical oncology has made a decision to join Tata Memorial Hospital in Mumbai. So for them, the choice is already made. Now, actually, the dilemma is for the candidate who has got a rank around 60, 70, 100, 120, or 200, where they are having multiple options, where they have to choose between a MCH degree, where they have to choose between a DNB degree, where they have to choose between a hospital which is quite far from their hometown. So all these things you have to take into consideration before selecting a particular hospital. So thing is, as I said, what you are going to learn in the coming 3 years is going to be the foundation or base for the upcoming 30, 35 years. That is going to be your career life, your personal life, your financial life, everything what your life is about matters down or boils down to the coming 3 years. So you have to be very intelligent and shrewd in making a wise decision. So, having said that, for example, you are in a state of Uttar Pradesh or Maharashtra, and you are getting hospitals in south like Kerala, Tamil Nadu, or in Karnataka. Then you may be calling some residents or some faculty or some your relatives trying to find out about the hospital or medical college. So you will be getting some insight about the place. You will be getting some insight about the city, and based on that, you will be making a decision which is going to affect you in the coming 3 years and for the rest of your life. So, see, there is a small saying in our Telugu that Durapu Kondalu Nunupu. That means grass is greener on the other side. So you may be sitting in Uttar Pradesh and assuming that yes, there is a hospital in Hyderabad which is superb. And once you train MCH from such a hospital, once you go out and start your private practice, it will be all roses. So it is only an assumption. It is only an assumption unless you go down and see what's really happening, what is the quality of work they are doing, or when you go and interact with people only, you will come to know what's really happening there. Otherwise, it can be either of the end of the spectrum that if you do not know what you are going to get, you might be completely delighted or you might be completely dejected for making such a decision without knowing what you are going to get. So, as I said earlier, choosing a workplace is um, like a marriage. So you have to shortlist all the places where you are tentatively going to get according to the last year or before year's seat allotment per Joe list. Take it out and make a list where you are going to tentatively get a seat for your rank. And then pack your bags and don't be lazy, move around, go and visit all these places where you have made a short list, meet people, interact with them, experience that, and then you will have a resonation. You will have yes, a good vibe or a bad vibe after going to a particular place. Experience, come back with that experience. And then come back to your home, sit with your family, talk with your wife, or talk with your spouse, with family, and all these things, and then you have to take a decision. As I said, now at this crossroad of life, you will be having parents, geriatric parents who might be having some health issues, financial issues, and recently married or having a newborn. Wife or spouse will be doing some post graduation or some job. So you have to balance your career as well as your family life before taking a decision on where you have to take your seat. So all these things matters because having a good cutting place or having a good going into a good hospital without any family support and a lot of pestering from your spouse daily, you won't be happy in you won't be having a happy living. So all these things, small things, will matter in making a good decision, which is going to impact the quality of your life. So having said that, there are absolutely three most important things that you should take into consideration before choosing a particular place for the upcoming 3 years. One is, as a surgeon, that we need to have good cutting because we learn by experiencing it. Unlike medical branches where they can see and learn, our way of learning is by doing it. So there is no point in doing a DM degree, DM MCH. I mean, in the sense देख के कुछ सीख नहीं सकते हैं. So it is always better to train in a high volume center. Yes, so especially um, you are going into a new branch, urology, neurosurgery, cardiothoracic surgery, whatever it is, without having hands-on experience. Once you come out of your MCH or DNB course whatsoever, you'll not be confident enough to operate in your private setup. So it is essential and of paramount importance that you go into a place where you will have good hands-on training, because at the end of 3 years again you should not be at a crossroad where you should be making a having a, discussion where you want to go for fellowship or advanced training, or you feel like your training is inadequate and you want to work in some hospital as SR. Then by the time already your age will be 33, 34, or 35, and by the time already you are being away from your family, all these things matters. So what you are going to decide today is going to have a very, very deep impact on your future. Mm, so for a urologist, I would suggest the bread and butter for a urology course is you should be able to do all endourological procedures. So especially stone disease and BPH. So at the end of your training, the main criteria is by the end of your training, you should be confident enough uh, um, to be operating on any stone disease. So you should be confident enough that you should be doing a URSL, PCNL, RARS, laser lithotripsy, and you should be able to confidently do TURP and TURBT. If all these things you are able to do, then yes, your training is adequate. So how do you know that you can perform a PCNL once you are out of the curriculum? So you have to talk to the residents who have already been trained there or who are actually pursuing the particular MCH course there. Go there, interact with them, and you know the exact scenario what is happening there. You will come to know how many cases each one is doing before they are coming out. So to have good hands-on training, at least a urologist should be doing 25 to 30 PCNLs, 40 to 50 URSL, at least 20 to 25 of TURPs, and he should be having at least 5 to 10 hands-on training on pyeloplasty or open nephrectomies. So if you are able to do all these things before you come out of your training program, then yes, you can blindly join such a training program. And additional advantages like laparoscopy, robotics, uh, and transplant program. Yes, if they are there, definitely it is a plus point, but it is not mandatory that you need to must have these programs in your these things in your training program, because there are many DNB institutes in the country which are offering high class endourology work, but there is very less transplantation work. For that matter, there are also many medical colleges where they are doing lots and lots of endourology work. By the time one urology trainee comes out of such a hospital, he will be doing left, right, and center all endourological procedures, but he might be faltering or doing a transplantation and procedures like urethroplasty. So I don't think that really matters, because ultimately, whatever you are going to learn in the 3 years, you should be having a solid training. So I will tell you, see, for instance, there are 100 urologists coming out, hardly 5 to 10 of them will be going into transplant program. Baki ki 90 urologists, na, they will be doing basic endourology work. For instance, I have done in a high volume transplant center. Now I am practicing in a tier 2 city where there is not much scope of transplant at the present. So maybe down the line, 5 years down the line, maybe I may also start transplantation program. But now, as an initial beginner in my practice, I have to consolidate myself doing endourological procedures. So all this thing matters. So if you are in a program where you are getting good hands-on training of doing at least 20 TURP, 30 PCNL, 30 URSL, then yes, it's a thumbs up for you. It will give you 3 points. If you are doing less than 5 URSL, 5 PCNL, 2 TURP, 3 TURP, then it's a 0 pointer. So there is no point in joining such courses. So choose wisely. For this, again, as I said, now you have to pack your bags, go and meet people. They will guide you on what's really happening. So that is how you should make a decision on the cutting side of it. So coming to the other side of it is you should know how your mental state. I mean, in the sense your environment or work environment. Work environment, how toxic is the department? You pretty well know there are some places where work is good, but department is also toxic. So if you are in such a place, then there is no point. You will not have adequate, what to say, though there is good amount of cutting, you may not be having a good training program there. So you have to balance cutting as well as toxicity. So have a chat with the seniors or who passed out, experience the hospital, meet the faculty. You will come to know what you are going to get in the upcoming 3 years. That is one side of it. That is from the surgeon's cut. That means the cutting chance of it, cutting side of it. So other than that, there is also medical side of our training program, that is academics. So coming to academics now, you should have at least bare minimum academics where the faculty will encourage you to go to conferences. It will help you to interact with people. You will come to know what's new in technology, what's new in what's happening new in urology, what your peers are doing, how to develop yourself. All these things will happen when you meet people, when you attend conferences. But if you are in a facility where the faculty is not interested in any sort of academic programs, then it is a 0 point. There is no point in joining such courses. Though there is good cutting, na, what happens is it will be like blind cutting. You will not be having any protocols. You will not be learning the right way in the right way. So it will be like, ठीक है, stone आया, चलो सर्जरी करो. You will not understand कब सर्जरी करना है, कब छोड़ना है, क्यों छोड़ना है. All these things will happen only when there is a good academic program. That means you should also be choosing a hospital where the mentor or the faculty is student friendly and having some interest in academics. So having said that, there are some institutes where they are only academics. That means they make you do paperwork, they make you do all sorts of चलो presentation करो, चलो journal club करो, चलो publication करो, 10 publication होना है. And again, see, this is all dog work. So these are again two extremes of academics. So you should be in a place which will balance your training program. So this is the medical side of your surgeon career. And the third point, which is the most important and final point, is balancing family. As I said earlier, na, your spouse may be working, your parents may be longing to be with you. Already you have been MBBS, MS, you have been away from family. So all these things matter. So before taking a decision, see, there are situations where you might be from North India, you may have to choose a place in South India. Your wife is already doing finished her MBBS and she is opting for PG somewhere. You may have to strike a balance where you both can. And one more very important thing, which I have realized over the years of couple of years in my private practice is playing to the advantage of home turf. In the sense, if, for example, there are certain situations. For example, there is a student who has done his MBBS, MS from his hometown. For example, I spoke to a couple of students who have done their MS and MBBS from Ahmedabad, and they are tentatively to likely to get urology seat in Ahmedabad, and for that matter, anywhere in the country. So if you are going to practice in the same place, then if there is not a gross difference between the training program between a place which is in your hometown and a place which is quite far away from you, then better to make a choice which is in your hometown, because in the course of 3 years you will be acquainting with lot of people, you will be developing PR, you will be developing social relationships, you will be developing yourself financially. All these things matters because once you are out in private practice, if you are having a home turf and you have done your MCH from your home ground, on day one of your practice, you will be having OPD. So that really is a very, very good sign and a positive encouragement, and it kicks off your practice beautifully. So you have to play to your advantage when you are having situations like that, rather than choosing a place which is quite far away from you. just for the sake of exploring new places. Of course, again, having said that, it's one's perspective of life, what he wants or what she wants to do with it. But planning career again, this is just from my experience that if you're able to develop your PR in the coming 3 years, then it will definitely add to your advantage when compared to your peers. And one more important thing is balancing your post MCH or post DNB bond status. So each state has got its own respective bond and norms. So you have to talk to the particular people who are doing a PG there. Go down, fly down to that particular place, talk to, interact with people, get to know what's really happening there, experience that hospital, and then you'll have um, a good sense on whether you should really go and take a seat in such a place or not. So with all this in background, you have to make a wise decision in choosing your place in the coming 3 years. And one final question is, does really doing a MCH versus DNB, does it really matter? To be frank, from patient perspective, it doesn't matter if you have done your MCH from AIMS or Safdarjung or SGPGA or from a private medical college or from a DNB institute. For him, all that matters is, are you a safe surgeon or a good surgeon or not? So ultimately, he is giving his body to us with full faith and expects us to return it in good shape. So for that, ultimately what boils down again is your quality of training, your temperament, and your surgical skills, and all these kind of things. So how you can develop all these things is you have to make a wise decision. That means you should be in a place where you will have good cutting. You should be in a place which is amicable for both your uh, career development as well as for your from your family front, and you should be in a place where you will be working in a friendly atmosphere, not a hostile atmosphere. So, bear all these three important things to satisfy your career front, family front, and it should be a environment friendly. And also, last but not the least, uh, you should have a sound knowledge on the uh, finances. What is going to happen in the coming 3 years? Is it going to be a good investment of time, and is it going to be a good investment of time and money in the coming 3 years? So you have to make a decision. You have to make a decision based on all these factors. So that is how you should plan your choice. So make a wise decision. Make a wise decision. It really doesn't matter if you are going to do DNB or MCH from a government setup or MCH from a private setup, as long as they meet all these criteria. So with this, all the very best for you in making a selection, and all the very best in life. Stay fit, stay healthy. If you are having any queries regarding the counseling process, feel free to contact us on www.viseacademy.com, or you can reach out to Dr. Kaushik Sharma, or you can reach out to myself, Dr. Harshavardhan. We are more than happy to help you and guide you in making a choice of your career. All the very best. Namaste.